I have an announcement. Every week I have an announcement. We are still hiring for a transition specialist. This position is a 30-hour-a-week position with benefits, including health insurance, retirement plan, paid time off, a flexible progressive work environment that's at Accessible Resources for Independence. I'll put the job position description in the chat box as a file for you all to use it. If you're interested, we work within Anne Arundel and Howard County, and we're looking for someone who has experience with exiting a long-term care or rehab setting and entering back into the community to help us work on our peer support grant that we have with the state. Any other announcements? Okay, well, I think we should go ahead and get started. Hello, my name is Katie Collins-Erkey. I'm the Executive Director at Accessible Resources for Independence. Again, we are the Center for Independent Living, serving Howard and Anne Arundel counties. For those of you who do not know, Centers for Independent Living are disability resource and advocacy organizations run by people with disabilities, for people with disabilities. We're so happy to have you today on Independence Amplified Maryland, brought to you by the 7 Centers for Independent Living in Maryland. We are here to provide this as a platform to educate the public about the capabilities of people with disabilities, and our message is, I am independent, I am safe, I am prepared, and I am in charge. So we're really excited to have you on. I'm going to turn our program over to Lori Magruder. She'll introduce herself, and then our guest speakers today. Thank you.
Okay, thank you, Katie. So as Katie said, I am Lori Magruder. I'm the Executive Director of Resources for Independence. We are the Center for Independent Living in Western Maryland, serving Garrett, Allegheny, and Washington counties. And again, thank you all for joining us. I'm going to give just a little overview, and then I'm going to turn it over to our speakers. But today's program is going to be provided by representatives of the Mid-Atlantic ADA Center. The center provides information, guidance, and training on the Americans with Disabilities Act. They are your contact for any ADA question or concern you have. We use them all the time. They tailor their services to meet the needs of businesses, government entities, organizations, and individuals in the Mid-Atlantic region. Okay, guys, make sure I get this right. Mid-Atlantic is DC, Delaware, Maryland, Pennsylvania, Virginia, and West Virginia, correct? Okay, all right, cool. So I'm going to go ahead and turn it over to co-director Karen Goss, and she'll introduce the other representatives on hand. Thank you.
Good afternoon. Thank you, Lori, and thank you, Katie. It is a privilege to be part of the activity this afternoon, and I wish you much success with this program moving forward. It's a really a powerful forum that you have put together, and I appreciate that introduction about the ADA. I apologize, but I'm getting a pop-up on my screen that someone is having some accessibility issues. Do I need to pause until those are corrected?
The accessibility issue is just asking the speakers to slow their speech.
Oh, okay. Well, the speaker will do that. Thank you so much.
It was probably me. I talk really fast.
Yeah, it's me. My name is Sama Balomo, and I lip read on Zoom, but I can't do that at that rate, at Erkey rate.
Okay. Thank you, Sama. So, as Lori said, the Mid-Atlantic ADA Center provides an array of resources in the Mid-Atlantic region. We are a federally funded program. NIDLR funds us, and we're one of 10 centers across the United States. And the area that we cover is represented, obviously, by the SIL that we're speaking with today. So what we want to share with you is the resources that we do have. But to talk a little bit beyond resource, when Lori mentioned that they contact us, one of the key components of the ADA centers is we have a call line. It's a toll-free number. You can call in to the ADA center and get any questions that you have answered for you in a confidential way. Oftentimes we'll have people calling us from both sides of a question. So sometimes an employer will call us not knowing perhaps that the employee has called us. We certainly keep that confidence, but we provide answers to those questions as they relate to the 5 titles of the ADA. Let's just take a moment to talk about what those 5 titles are. Title 1, as mentioning my example, is employment. So we answer all questions on employment, and employment is covered from pre-employment through the hiring process, that would be, then when an individual is actually on the job, followed by should there be a separation of employment, you have rights under the Civil Rights Law of the Americans with Disabilities Act. Title II is our state and local governments. And again, that is access for all individuals to programs and services. And state and local governments are required to modify their programs for individuals with disabilities as needed. But obviously, the modifications can't alter the intent of the program to the extent that it is no longer providing it in the manner that provides the information and guidance and direction as intended. And Title III is places of public accommodation. That would be going to restaurants, theater. Someone mentioned golf early on when we were gathering for the call. Places of public accommodation are required to follow the Americans with Disabilities Act as well. Title IV is telecommunications, providing access for individuals to be able to have the appropriate communication necessary for deaf and hard of hearing. And Title V is the miscellaneous. It covers federal government activity. And one of the things that federal government states under Title V is that technical assistance will be provided, which is what the ADA centers do. It has some caveats on lawsuits and insurance and things of that nature as well. And what the ADA centers do is we stay abreast of what is going on with the activities in the community. And we are not an enforcement agency, but we provide individuals and businesses with and state and local governments with the information that they need on the Americans with Disabilities Act so they can make sure that they are either complying or implementing so they know their rights and responsibilities under this important civil rights law. This year, we're celebrating the 30th anniversary of the Americans with Disabilities Act. And through that, we are hearing many of the successes that have taken place over the last 30 years since the signing of the Americans with Disabilities Act. And many things have happened in our communities as a result of the ADA. We often, when we do our trainings, we talk about some of these things in relationship to what a benefit it is to the community as a whole, and not necessarily people link it to the ADA. Curb cuts are a perfect example. We hear that that's beneficial for many other members of our community, but in fact, curb cuts obviously were due to the need for mobility devices to be able to maneuver comfortably off a sidewalk and that kind of thing. So there are many additional benefits to what has happened with the passage of the ADA. We also look forward to what will be occurring over the next several years with the implementation of the ADA. There's still room for improvement. We're looking at employment and how employment has not really changed too dramatically in the 30 years since the passage of the ADA. There's a great deal of interest in how we can continue to make sure that individuals with disabilities are given that equal access for individuals with disabilities. So we are all watching and aware of the areas that we still need improvements in the ADA, but are pleased with the progress in so many areas that has been made. The ADA centers provide this information and the resources and training in a variety of formats. Obviously, now that we're working virtually, and we have continued to stay in place in terms of the services that we provide, However, we are doing things remotely. So we've moved to virtual platforms with our trainings. We're still providing technical assistance over the telephone. And I did see a request, and we will put in the chat box both our website and our phone number, our 800 number, so you can reach us as necessary. Thank you, Katie, that she has placed the website, which is adainfo.org, but that is available in the chat box. And our phone number, which is 1-800-949-4232, has also been placed in the chat box for your reference. So we continue to provide the services, and we do a lot of customized in-person trainings in the past, but a lot of customized trainings for our audiences. We also speak at local, regional, national conferences. And in fact, in the fall, we have our annual conference. I might get the year, maybe our 23rd, 24th year of providing this conference within the Mid-Atlantic region. This year it's in Northern Virginia. And I am corrected, it's our 27th year of the conference. I think that falls into the doesn't time fly when you're having fun. So our intent is to hold this conference in Northern Virginia, and we will also post in our chat box the link. You can get it through our ADA info page, and there is a direct link as well if you're interested in that conference. So we have that annually. We do publications, we do fact sheets, guides, we have an accessible meeting guide, handbooks. We also work with the ADA National Network on what we call national projects, things that there is a heightened interest in across the country. We're currently working on a fact sheet or informational sheet on face coverings, on face masks during COVID-19. So we do work very hard to stay relevant. We stay very closely connected with both federal partners, the EEOC, Department of Justice, as well as, I shouldn't just say them, but Access Board, Department of Transportation, to make sure that we're aligned and in tune to what is going on at the federal level as regarding the information that we provide and share. I know that during COVID-19, there's been many interest and changes and lack of information available, and the ADA centers have worked hard and closely with our federal partners to make sure that we are continuing to provide you with the resources and information as it relates to individuals with disabilities as we maneuver and navigate this, this pandemic and how it's impacted individuals with disabilities. I'm going to take a pause, and I'm going to ask Nancy if she would like to talk about the resources that we have available as it relates to COVID-19, and additionally, some of the questions and concerns that have been raised and how the ADA, and following the guidelines, the ADA centers and the ADA as the civil rights law, following the guidance under the CDC, EEOC, and Department of Justice. Nancy, can I pause here and turn it over to you?
Sure, absolutely. And we have a question in the chat feature that I think will tie in rather nicely to that. As I'm sure we all know at this point, COVID is, you know, the hot topic of the day, week, month, and season and year. And as Karen said, we're working on materials and webinars and things to get information out to people. We do have a page on our website at ADA Info. You'll find a link on our homepage to a page with a collection of information and resources that are specific to COVID, and most of them specific to ADA or disability issues, whether it be employment, transportation issues, housing issues, education issues, all that sort of thing. And the question that we have that's come into the chat box ties in nicely, because with COVID, we're seeing so many things, more things, moving into the virtual realm, moving onto virtual platforms like this, for example. And someone has asked, you know, they're saying, I noticed that some of the government sites are not accessible for people who use screen readers, and does the ADA cover that particular technology challenge? For some of them it does. Now, as Karen mentioned, Title V of the ADA covers part of the federal government. It covers Congress. It covers the legislative branch of the federal government, but not the other two branches. Title II of the ADA covers state and local governments, and then Title III covers many types of private businesses that serve the general public. So most of the parts of the ADA where websites and virtual platforms and all of that sort of thing come into play are under Titles II or III, and which is regulated by the Department of Justice. And they have said for years and years and years, for decades, for 20 years, they have said that those titles reach websites that are operated by these covered entities. It's part of what they do. It's part of how they communicate with the public, provide information, and of course, at this point, how they interact with all of us. We go online to do things just like we're doing today. We go online to buy things and participate in things, to register for class and go to class. So the Department of Justice has always said that the ADA reaches all of those activities. And as time has gone on, mobile apps and all the rest of it is part and parcel of how we operate. And so the ADA reaches those things. The courts have been a little bit all over the place, particularly when it comes to how Title III reaches websites and mobile apps. The Department of Justice is pretty broad in how they believe the ADA reaches those things. Some courts have been pretty broad in their interpretations, and others have been a little more narrow in saying that there has to be a physical place when it comes to Title III. There has to be a physical store or an office or a place associated with the website before Title III is triggered. Department of Justice is a little broader in their interpretation. And even in other areas of the ADA, for example, employment. When it comes to employers, these days their recruitment activities are online, their application activities are online, their human resources functions are online, right? So the ADA reaches all of that. It certainly has been an area of some contention and some challenge. It's like a lot of other things that when we talk about buildings, it really isn't, it's not rocket science to design a website to be accessible. But just like a building, if you've got an old one that wasn't designed to be accessible, it can be a little more challenging to try to mitigate it, to make something old accessible. The Department of Justice has done a lot of enforcement activity around websites. They've entered lots and lots of settlement agreements with both public entities, state and local governments, and private businesses. When they do agreements with state and local governments, they almost invariably include requirements related to websites and things of that nature. And they've done similar things in the private sector. They've done some big settlement agreements with post-secondary educational institutions, stores. H&R Block was a big one. The Peapod grocery app and delivery system was a big one. So they really clearly, their position is that the ADA applies to websites, mobile apps, and all of this, online activity. So let's see what other question we have here. To what extent are we required to represent the current positions of the federal government? In other words, are we a federal agency or just a federal grantee? We are a federal grantee. We're not a federal agency. And as Karen mentioned, one of the sort of unique things about the ADA centers is that we are not allowed to even engage in advocacy or any kind of enforcement activity. We are required to be impartial. Our services are confidential. We're not mediators. We're not any of those things. So we are really public educators. That's really our role, is to educate the public. We're not on anybody's side. We don't take positions. And we have another question here. Does Section 504 apply to federal agencies' accessibility? Section 504 applies to all of the agencies of the executive branch of the federal government. So all of those agencies we know and love, from agriculture to Veterans Affairs and everything in between, Department of Commerce, Health and Human Services, Post Office, all of those executive agencies are covered by 504, as well as any entity, a business, a nonprofit agency, or a state or local government that receives funding, financial assistance from any of those federal agencies. So the reach of Section 504, which is sort of the granddaddy, if you will, or the older sibling of the ADA, reaches pretty broadly as well. So I don't see any other questions right now, so maybe I will kick it back to Karen to talk about other issues.
I wanted to take a moment when Nancy said that we are educators. I wanted to take a moment to just sort of introduce you to who our team is and how we manage the center. We have a small team. We're joined today, I think I just see one of my colleagues, Barbara Van Dyke, who manages our social media and a lot of our outreach activities. You'll see her. I hope you're following us on our various platforms. Barbara, I would invite you to put some of that in the chat as well. But there are 8 of us at the ADA Center providing this information and resources and guidance. So not only are we providing information that has been developed specifically for our use, much of it we've developed on our own, and we are continually developing new information. Barbara has put in the chat room some information on us for you social media folks. But at any rate, my name again is Karen Goss. I'm the co-director with Anne Deschamps of the center, and we are funded through NIDLR, but we are under our organization. Our administrative body is Transcend, and Transcend also works with individuals with disabilities to help them with employment. So they have administered our grant for 4 or 5 grant cycles. So, and as we said earlier, the ADA is in its 30th year. We have been managing this grant for all but the first grant cycle. They're 5-year grant cycles. So we have a vast array of experience. Nancy Horton's experience goes, I always say to folks, she was managing and teaching and educating on the ADA before it was a formality. She has a extensive background on the ADA, and we've been privileged to have her as part of our team training our other technical assistant staff. Our lead person, Carlene, if you all do call, she's most often the individual that you would have the opportunity to speak with, very knowledgeable. I want to emphasize what Nancy said about the confidentiality of our calls. We do get a number of calls, and although we are federally funded, we don't report any information, any identifying information, anything to anyone along the line. We are not a whistleblowing organization. If you were to call and had a concern about accessibility or how you were being treated on the job, or that you had gone into a theater and you weren't provided with the proper accommodation, we are helping you by providing you information and connecting you with the resources that you need, but we don't in any way insert ourselves in the process to advocate for you, as Nancy said. But we really want to emphasize that the confidentiality of the information that is shared with us, it stays just that way. It is confidential, and it goes no further than the person that receives that call. Our team is rounded out by Maynor, who provides our e-learning platforms for us. He manages our webinars and now the various platforms, the Zoom. He's become a Zoom expert, it seems to me, overnight, assisting us. But he manages any number of webinars that we do put on. We do podcasts. He also coordinates those efforts for us as well. We have an administrative and office manager, Jasmine Powell. She provides additional supports. She might be the person that you might speak to when you call to talk to our information line. And she works on special projects for us. We have a trainer. His name is Caleb. Caleb provides our training. Again, we're doing that virtually, but he does a lot of face-to-face. He and Barbara and Jasmine and Nancy are part of our team that is putting on what we're calling ADA Con this year, our ADA informational conference that will take place in September. And then, of course, I mentioned Nancy, who also provides technical assistance, manages the TA team, and provides the resources for our newsletters and assist in writing the e-bulletins. Carlene does a bit of that writing. Nancy does a great deal around e-bulletins. We try to stay as current as we can with information and keep our information new, updated. Although the ADA is 30 years old, the questions pour into the ADA Center. I know Nancy can attest to that, and an uptick of calls when things happen in our communities that put at civil rights, the ADA, in question, and people want to verify and further understand what their rights and responsibilities are. So I say that to say that if there is information that you are looking for on the Americans with Disabilities Act, and you haven't been able to put your hands on it, and you're seeking additional knowledge and guidance, please do not hesitate to reach out to us. You can call us, you can email us on our email directly. You will get a response from us. One of the things that we pride ourselves in as part of our funding, we man, or what do they say now? We have a live person, man, woman, or neutral gender. We have a person that answers the phones live for you. So we find that to be rather unique in today's push 1 to leave a message for Karen. Push 2, if you would like to get additional information about our conference. Push 3, well, you get the idea. We do have someone available that does answer your calls, and as busy as our lines are, sometimes it is a return call. But I wanted to just familiarize you a little bit with our team. I see folks on here whose names I do recognize. I know a number of you are familiar with the work that we do and that we do provide. The link in that the ADA centers have at the national level provides us with an opportunity to stay abreast of issues and concerns across the country. And coupled with that, one of the things that our grant requests that we do is that we have a component related to our grant around research. So we are funded to make sure that we have by our own selection, we heighten our knowledge and information on a topic of our choosing around what impact the Americans with Disabilities Act has had in the area of research. And they're different across the country. And I invite you to look at our website, and it will give you some information on our research. We are trying to understand how the Americans with Disabilities Act and the information available is impacting both our seniors and our younger members of our community. We want to understand how our community knows and recognizes who ADA coordinators are and the important role that ADA coordinators play in our communities. We're interested in aging population and assistive technology and employment and what impacts are along those lines. Each of the centers is responsible for providing training, and every year come together for a conference to discuss some of those research projects and how they may benefit the disability community. And again, I would invite you to look at our website for more information. Those studies are not completed, and you will be able to reference studies and research that is going on across the various ADA centers. I bring up the partnerships because one of the things that the ADA centers are doing currently that wasn't part of our initial funding is with the concerns of, excuse me, I'm getting an error message. Please forgive me for just a moment. My apologies. My plug slipped out and therefore I was leaving you. Got a low battery warning. My apologies. But at any rate, with the opioid crisis and just in general, substance abuse, we have had an increased interest in the impact of substance abuse and coverage under the Americans with Disabilities Act. And a subcommittee was formed across the ADA National Network to make sure we were providing information to the community about rights and responsibilities under the ADA as it relates to recovery. Now, addiction is not a covered place for the ADA, but recovery is. And Nancy, I see you might want to chime in there. I will turn it over to you. I don't want to go too far down that lane, other than to say that we have developed a couple of fact sheets around individual rights as it relates to addiction, recovery, and coverage under the ADA. Nancy, would you want to speak a little bit more to that?
No, I think you covered it nicely. I mean, we
Okay.
have there are a couple of fact sheets on the National Network website. And I think there have been a couple of webinars. That's one thing that I'm not sure we've mentioned or really highlighted is the national webinar program. We do a lot of webinars regionally, but the National Network has an extensive webinar program, and all the sessions, both regional, ours and the national networks, are all archived. And so there's a really terrific collection of archived material, webinars. Some of them are regional websites. People can get continuing education credits of various types for some of those sessions. And I think the National Network's collection it's very extensive on lots of topics, including, I think there have been a couple on addiction, opioid crisis, all kinds of topics. There's a series on legal issues, a series on structural design and accessibility. There's a general series where there's a lot of sessions on employment. So that's a really good program. We also have a couple questions when we get another moment.
Thank you. That's an important thing to reference, Nancy, and I was remiss in not sharing that. I just put the ADA National Network link website in the chat room so you can take a look at that. And the time that you spend there, I think, would be well spent. We archive, as Nancy said, all of the information, all of the webinars, and if you have anything in particular you're looking for, feel free to give us a call. But I think it's important to take a look at those because, again, the relevance, as Nancy said, we have done some on addiction and the opioid crisis, and you can look for information there. And Nancy, you said there's some questions. Let's take a peek.
Yes, we have a few questions, a couple of really great questions, actually. A couple just about how we kind of operate, which are great questions. One is, do we provide callers with contact information of agencies that can advocate on their behalf, like the Centers for Independent Living? We do that hundreds, if not thousands of times in a year. We provide lots of referrals. We get calls about not only every aspect of the ADA, where sometimes people need to be referred to an enforcement agency or a legal service agency or a protection and advocacy agency or any number of ADA related agencies, but we get calls on non-ADA sort of topics as well, and we always try to get folks pointed in the right direction if they're calling us about they need social services or issues that aren't addressed under the ADA. We do a lot of referrals as part of our work. And a sort of similar question, when do we refer somebody to the ADA Center versus when would the Job Accommodation Network be an appropriate referral for employment-related concerns? I think the Job Accommodation Network is a great project. We refer people to JAN, Job Accommodation Network, ourselves very often, particularly for the practical side of things. They have great information about the practical side of accommodations, lots of ideas, products, strategies, great information on that side. But they're always a good resource for employment related calls. But we are sort of the generalists of the ADA world, if you will. You can call us about any and all aspects of the ADA, and we will try to answer your questions, find the appropriate resources for you. Now, this other question is about, do we talk to people about sort of social things that are going on, areas of concern like quote unquote fake service animals, or the quote unquote legal right card that says, I have a disability and the ADA says I don't have to wear a face mask and Department of Justice says so, and those kinds of things. And we absolutely talk to people about those kinds of things, about those kinds of concerns, and we try to provide again, the information about what the law or the regulations or the courts are saying about the ADA, and in some cases what they're not saying. Sometimes we joke that the most common answer to an ADA question is it depends, because so much about the ADA is all about the situation and the context and the individual and the various factors, and that's very common. But yes, we talk to people that are concerned about the fake service animals and the cards that say I don't have to wear a face mask, and we try to provide people with the information. For example, a business might call us up and say, it's my understanding that I can't ask anybody for paperwork or proof that their animal is a service animal, and I'm afraid that the animal is going to bite somebody or something like that. And we can give them information about, it's true that they shouldn't be asking people for documentation and proof and all of that about a service animal, but they can expect it to be well behaved and under control. And if it's not, they can address that. They don't have to allow, an animal to be running around and out of control. And some of those issues are similar with these mask questions that we're getting. It's not, as the Department of Justice said recently in a press release that they put out about mask policies and mask issues, there's no blanket exemption in the ADA for people with disabilities to be exempted from safety rules, which is what a mask, policy really is. It's a public health and safety sort of a rule. So that, again, the ADA, when you hear about, it's always yes or it's always no, or it's a blanket policy, that is sometimes the ADA tends to not work that way. More often than not, it's it's about finding solutions. It's about maybe compromises. And sometimes there can be adjustments made and accommodations provided, and sometimes there can't be. So that's both the challenge and the opportunity of the ADA in a way. It's not a simple formula, but it is designed to sort of enable us out here in the real world, people with disabilities, businesses, employers, what have you, to try to come up with solutions in our own context. So I think we have one more question. Let's see if we can maybe do it in about 20 seconds, because they told us that we needed to give back a little time here. Just my personal experience.
You can go in for like another 10 minutes. You're good.
Oh, okay. Yeah. Well, we could talk about service animals that long.
Because I have a question too after this next one. I'm sorry.
Okay. Well, let me see what this one says about service animals here while we're on the topic. Using a service animal, in that particular case, each dog, which is a service animal, has their own ID that the person carries around. So if there's an issue, they can pull it out, and it has information about the school and so forth. And that doesn't, that's not really an ADA thing. I mean, under the ADA, ID cards or special tags or special vests or things aren't required under the ADA. Now, if folks have something like that, and choose to carry it around and offer that as information, that's their choice. They certainly can do that if they want. And if it's something from a professional dog trainer or training program, that's fine. But it doesn't really mean anything in terms of the ADA. A person could train their own dog, and it could be a perfectly legitimate trained service dog that provides a service, a disability-related service to a person with a disability. And if it does that service and it's a well-behaved, dog, then it's a service animal, and it doesn't have to, have paperwork. I think a lot of people carry those kinds of things around to sort of just make it easier when people may question them, which, business operators are allowed to at least ask a person, if it doesn't have a vest or something and it's not obvious that it's a service animal, a business could say, well, is that a pet or is it a service animal? Is it needed because of a disability? Or what has it been trained to do? What is it trained to do for you? They can't ask more than that. They can't ask, what's your disability specifically, or show me what the dog does, or anything like that. They can't do. But, some folks choose to have the vests and the cards and the things to just sort of ease their way, and that's absolutely fine if they want to, make the choice to do that. But no, people, entities that are covered under the ADA cannot ask for proof under Title II or Title III when somebody's going out to a public place. A store, a restaurant, city hall, the county recreation department or senior center, anything of that nature. It's different in employment. If someone wants to bring an animal to work, that's a reasonable accommodation process, and employers can ask for documentation of disability if the disability isn't known or obvious, and it's a little bit of a different process under employment, just like any other accommodation. But if you're going out to the store with your service animal, just those couple of questions, no more, no requirement for proof for anything like that. Let's see, we have another, not sure this is a question or maybe this is a promotion of an event, which we're happy to do. I teach in the occupational therapy department at a university. We're planning an event in the local mall to highlight the 30th anniversary of the ADA, yay, in combination with an art exhibit by an artist with a disability. You should send us the information about this. We'll put it on our website. We have a page on our website which has all kinds of listings for events and blogs and exhibits and all kinds of information there. We'd be happy to post any information. It says we are revamping to create the art exhibit virtually and create alternative outreach for information on the ADA. Well, that sounds just fantastic. We would be happy to, and Barbara's just put in the link to the page where we're posting all of this sort of information. We're happy to post your virtual event, your live event, all of that sort of thing. Check that page out. There's a lot of fun stuff going on this month. So let me kick it back. I think we have just about gone through our time here, and we don't want to wear out our welcome.
So Nancy, this is Bondar Rosario. I'm with MDOD. I do have a quick question for you. So I actually had a conversation with someone that I had met a couple of years ago who has a child with cerebral palsy, and she's in the market now for looking for a new home. And she found this condo downtown off of Holiday Street, not too far from City Hall. The problem she's running across is that everything is accessible with the exception of the lobby area. There's one accessible hallway, but it's kind of like the same hallway that I guess the service people use to roll the trash down, to the back alley and so forth. So, and that's the only accessible way. And it doesn't even lead to the resident parking lot. It leads to the alley where the dumpsters are. Is there anything that she can do as far as like possibly maybe getting them to either make accommodations where it's a little bit easier travel down that hallway, or even possibly making another alternative way of coming out of that lobby area, because the lobby area is nothing but steps according to her?
Well, when I hear condo, I automatically think that's private housing.
Yes, it is privately owned. Yes.
Yeah, and private housing is not covered by the ADA.
Okay.
But it is most likely covered by the Fair Housing Act, both the
Okay.
federal one and probably the state one
Okay.
as well. The Fair Housing Act is older than the ADA.
Mm-hmm.
It covers a lot of types of housing, all kinds of both public and private housing, but private housing the ADA doesn't cover. And one of the differences, one of the real distinctions between the ADA and the Fair Housing Act is that when it comes to structural accessibility, once apartment complex or private residential housing is built, there's no obligation on the operators to improve structural accessibility.
Okay.
Now, sometimes in something like a condo community or something, they will do that. They will say, hey, we want to make our community more accessible, and let's vote on it, and let's fund it, and let's make another entrance accessible, or put in an automatic door, or get a pool lift for the swimming pool or something. And they might choose to do that, but they don't have any obligation to do that if it's an older property. It was built before the Fair Housing Act went into effect, which was around the time about 30 years ago as well. The Fair Housing Act was amended in 1988.
Okay.
To extend protections to people with disabilities. Now, that's just to do with the structural access side of things, and individuals can sometimes, either with their own funding or with some assistance for funding or to have work done, can have structural improvements made, even in common areas.
Right. Yeah. She had mentioned that if she had to do it on her own, then she would do it. Right.
She might, and she might be able to get some funding assistance. There might be some resources. Check out a website called Home Mods,
Okay.
.org,
Yeah.
HOMEMODS.org. There, it's sort of a patchwork system out there, but there are programs sometimes based on income or age or veteran status or any number of factors. Sometimes Voc Rehab or other agencies will help to fund home modifications. And so
Okay.
that's a possibility. You know, housing operators also have to make reasonable accommodations in their rules and their policies and practices and so forth, regardless of when the building was built. But structural access is something where we see this real distinction between the Fair Housing Act and the ADA.
Okay. Thank you.
Nancy, if I could just say, Bong, also, you might want to reach out to a Human Relation Commission. Most city entities have a Human Relation Commission, and they do a lot with the Fair Housing Act. I've served on the commission in Cumberland, and we do a lot with fair housing and things like that. So maybe that might be another resource to reach out to.
Okay. Thank you, Laura.
Well, I don't know about you all, but I found this to be quite informative. I'm always amazed by the knowledge and expertise that we have in our own very backyard about things like the ADA, which has, you know, been such a wonderful piece of legislation and law that we've had almost 30 years now, and it's continually you know, revisited and used to ensure that people with disabilities have what they need to be out working, living, playing in their communities. So thank you to our friends at the Mid-Atlantic ADA Center. This is the month of the birthday of the ADA, so please make sure they put their website. They have some events coming up. You know, nationally, I've seen several different ADA centers hosting things, and then there's also, looks like there's in the chat an upcoming webinar from Transcend ADA Whole New World webinar. So be sure to check that out. I wanted to just remind everyone that we are here every Monday at 2 p.m. Next week, we will have Josh Basil, who will be discussing recreation opportunities that are accessible. And also, I just wanted to remind everyone that you know, the work that we do as Maryland Centers for Independent Living is not possible without our consumers, our community partners, our legislative officials. We count on you as well. So feel free to reach out to us if you have any concerns or needs. But also, we want to ask for your support. A $5 or $10 donation can go a long way. We've been using the money that we've gotten thus far for this programming to help us pay for accommodations for the program. So please keep us in mind when you're making charitable contributions. It doesn't have to be a lot, just every little bit counts. And you'll be able to do that when you sign up for next week's session, as well as we will be having an ADA focus session coming up at the end of the month, featuring several great advocates from our movement in Maryland locally, and they will be discussing kind of, you know, life before the ADA, life after the ADA. So far, we have Marian Vessels, former director at the Mid-Atlantic ADA, and Kathy Raggio, former secretary of the Department of Disabilities, both on my board. So I'm happy to have them. And there should be 2 other people showing up to be able to provide some information on that. So I think we're just about at the hour. Did anyone have any other input or community events that they didn't get to share, or news that they didn't get to share that they would like to do? Go ahead, Mike.
Hey, thank you. Well, hello, everybody. Look, I wanted to make a quick announcement that in August, on August 17th, we're going to take this Zoom program, the IAM program, and talk for an hour or so about independent living centers and how you might want them to do things differently or better or more. So please be thinking about what you think Centers for Independent Living should be doing that perhaps we aren't, and be prepared to come and talk to us on August 17th. So it'll be an exciting opportunity for us, at least, to get some really good public feedback for you as we look toward the next 3 years of our state plan and look at how we can really make a difference in the lives of people with disabilities. Other than that, thank you everybody from Transcend for a fascinating show. You guys always do a great job of presenting materials. We really do so much appreciate it. So thank you very much, and see everybody next week.
Thanks for
Take
having
care,
us.
everyone.
Thank you, guys.
Thank you. Bye-bye.
Thanks so
Thank you very
much.
much.